The following program is presented by the Multiple Sclerosis Association of America and is made possible through the generous support of EMD Serono and Pfizer. Hello, and welcome to the Multiple Sclerosis Association of America's educational web video series, A Closer Look. The program you're watching is a closer look at the emotional impact of MS. Joining us is Allison Shaddy, a medical clinical social worker and an expert in the field of counseling chronically ill patients and their families. She's the author of MS and Your Feelings, Handling the Ups and Downs of Multiple Sclerosis. Allison is also a person living with MS since her diagnosis in 1995. Allison, welcome to the program. Thank you for joining us.
Thank you, Danny.
To begin with, can you tell us a little bit about your background and experience with MS?
Sure. As you said, I was diagnosed personally back in 1995, and I think it's important for the viewers to know that because I come to this subject both from a professional and a personal perspective. And that gives me the ability to not just sort of speak scientifically, but also from the heart. And I want people to understand that I'm very passionate about this subject, and some of the things that I'll be addressing today, I've actually experienced not just in my professional practice, but personally as well.
MS impacts patients on so many levels. How do you suggest that patients and their families cope with the emotional challenges?
That's a good question, and it does affect us on so many different levels. For me, the best way to kind of approach this and to cope is to really recognize that we don't choose to get MS, but we do get to choose how we handle it and how we cope with it. And that's a very empowering message, and that's one of the thoughts that I hope people will, take away from this presentation today. In some respects, MS really forces us to consider our lives, set priorities, recognize that we have to take care of ourselves, and in that sense, it creates a sense of urgency about living a life that's balanced, taking a look at our habits and how well we take care of ourselves. The really important idea here is that we do have choices, and we can be proactive, and we can make positive choices in our life despite having this disease. And that's really important because those choices are going to be what affect the quality of our life overall.
And that's good advice for anyone, not just a patient with MS.
Sure.
So you talk about making these positive changes that enhance our sense of wellness. Can you tell us a little bit more about that?
Basically, the way I see it is that healing really happens on three levels. You've got the physical, the emotional, and the spiritual. Traditionally, medicine kind of focuses primarily on the physical aspects, and that's great. But I like to take a more holistic approach so that we do deal with the emotional aspects and the spiritual aspects. I kind of look at it like we are a stool, and we need all three legs to stay in balance, and if one of those legs is missing, we tip over. So one of the things I'm excited to talk about today is the emotional as well as the spiritual aspects of working with this disease.
In your practice, what are some of the more common emotional issues that your chronic illness patients face?
There is almost what I would call a syndrome or a cluster of psychological symptoms that I see over and over again. I've worked with hundreds of MS patients and their families over the years, and what I want to start out by saying is that these sort of reactions are very common, and they're natural and normal and understandable. And there are also many things that we can do to sort of counteract these difficult reactions. But first, just to validate, some of the things you may see are typically denial, fear, depression, anxiety, low self-esteem, grief, loss, feelings of isolation, and even anger.
Can you tell us a little bit more about denial?
Well, denial, I think there has to be a little bit more understanding about that. There's a real difference between denial and acceptance and surrender, and people kind of get these things confused. But first off, I want to say denial is actually a pretty healthy coping mechanism to begin with. I think it serves the purpose of allowing us to psychologically catch up to the diagnosis. A lot of people are blindsided by this disease. They're not expecting it. And so denial kind of gives us that time to catch up. However, if we stay stuck in denial, then we run into some problems, because we have to reach that point of acceptance to be able to start getting proactive about the disease, starting to look at different treatment options, beginning to take help from other people, and really making those lifestyle adjustments that are needed. But unfortunately, some people still sort of view acceptance as being surrender, and they're really very different approaches. And I'll give just a quick example. If you're waking up in the morning and you feel like you need assistance walking, or you can't walk on your own, and you say, so I'm just going to stay in bed today, that is surrender. If you get up in the morning, you feel like you need help, and you decide, I'm going to get up, but I'm going to use my walker, or I'm going to use the wheelchair, then that's acceptance. And that's a big difference, and one is really a much more positive approach to life.
Mm-hmm. What types of fears do your clients discuss with you?
Well, fear is a big issue with MS. It's a very natural response. One of the unique aspects of the disease of MS is that it's very unpredictable in its nature. We really don't know from day to day what to expect, how the disease may affect us. So a lot of fear and a lot of anxiety really comes from anticipating what might happen. It's fear of the future. And I like to tell clients that, worrying is really more of a form of like praying for something that you don't want to have happen. When we put a lot of energy into worrying about what might happen, it really robs us of being able to enjoy the day. But some of the things that you might typically be worried about are very valid. Folks may fear being unable to work. They may fear losing certain physical abilities, being able to function, fear of being abandoned by family members. These are all very legitimate fears. It's okay to recognize it and acknowledge it, but we need to make sure we don't get carried away by these fears, especially if they haven't happened yet. So one of the strategies I advise patients to really practice is trying to take those fears and really just sort of put them in a box and close the box. For instance, if you're having trouble going to sleep at night because all these things are running through your mind, I would ask you to really visualize yourself opening a box, putting these fears and concerns in the box, shutting it, putting it under the bed, and saying, all these concerns will be there in the morning. I don't need to worry about them right now. The other aspect that I think is helpful is to really try to focus on staying in the present. Because oftentimes what's going on in the present is not nearly as scary or threatening as what we fear may be happening in the future. And there are several sort of ways to do this, and I kind of have like this 8-step technique. And I'd like to just go over some of those points, and perhaps the people that are watching today can kind of walk away with at least this one little strategy for dealing with fear. But the first suggestion is just to take a deep breath. Identify specifically what the fear is. What is it you're worrying about? Mm-hmm. Write it down, because writing it down right there sort of helps to diffuse the power. The next step would be share it with someone else. Talk to somebody else about it. Oftentimes by getting someone else's perspective or reassurance, we begin to feel better. And again, it diffuses the power. Ask yourself the very basic question, am I safe in this moment? Very simple, and typically you are safe in this moment, so that can be comforting. Try to stick to the facts of the situation, not the what-ifs or what might be. Don't make assumptions about what might happen, because none of us knows the future. So we really, we're wasting energy by, wondering what might happen. Avoid negative input. If you're around other people who are kind of bringing you down, or they stir up your anxiety, get away from those people. If you're listening to negative news on the TV, turn it off. And then try to create a positive diversion. We were talking earlier about how much we love our pets. Maybe it's just holding your cat in your lap and enjoying that, or taking your dog for a walk, or getting outside and being in nature. Anything that kind of helps you to calm down and to feel better. Allow yourself time to do that. And all of these things really do help to ease those fearful moments when we can get ourselves stirred up.
And again, that's just great advice for everyone in any situation. Since depression can be a common problem with MS patients, can you talk a little bit more about that?
Yeah, I'd like to talk about that because this is a huge issue for MS patients. About 50% of folks in the MS population will at some point experience a clinical episode of depression. This is a really high number compared to maybe 10 or 15% of the rest of the population. So we are at a much higher risk of experiencing depression. Again, I want to emphasize that so that if patients are dealing with this, they understand they're not alone and that this isn't unusual. The good news here is that depression is very treatable. It's one of the most treatable of all our MS symptoms. There are ways to do that through medication, through counseling. We have a video similar to this actually through MSAA that really talks in detail about what you can do for depression, and I encourage folks to take a look at that. But for now, what I would encourage people to do is if you feel that you are depressed, or sometimes it takes a family member or a friend even to say, I think you may need a little help, go and speak with your neurologist about it. They are very informed. They'll be able to ask you a series of questions to really, validate if this is what's going on. And then they can work with you to create a treatment plan. Maybe they'll refer you to a therapist. Maybe they'll work with you with some antidepressant medications. And this is important also because, number one, it's, of course, not fun to live with depression. But number two, many of the symptoms of depression mimic MS symptoms. So things like fatigue or pain, a lack of motivation, difficulty thinking, trouble with memory, cognitive issues. These things can either be MS or they can be depression. And it's been very interesting to me in my practice to have clients come in and think that their fatigue or cognitive issues are being caused by MS. Then we treat the underlying depression, and lo and behold, these symptoms resolve, and they feel much, much better. So there's really no reason to live with depression at this point.
How does one go about finding the right therapist?
That's a great question. It's easy to assume that everybody sort of is comfortable with therapy or, knows how to go about this, but many people have never been to a therapist before. I recommend that folks try to interview a therapist just as they would a physician or any other critical member of their medical team. I would start by asking my neurologist if they have a list of people. I think when you have MS, it's really helpful to work with somebody who also has some background in MS and understands chronic illness. So your neurologist ought to know a few therapists who sort of have that background. You can also work with the MS Society. They typically have a list of providers in the area who are familiar with MS. Talk to other MS patients. See who they have worked with, who's been helpful to them. So that can really help. And then if you do pick a couple of people, take the time. This is an investment in your time, and it's an investment in your mental health, and it's a key portion of your overall health care. So make sure you spend time talking to that person. Ask them the different type of questions that you would ask anybody. One of the things I think that is a real obstacle for folks in terms of getting treatment is financial, questions or concerns or limitations. Many therapists will work on a sliding scale basis if they know that resources are an issue. Oftentimes the MS Society will have sort of subsidized treatment, maybe 6 to 12 visits. I have a lot of patients who do that. Churches and other organizations can sometimes help fund therapy visits. So try not to let that be an obstacle in terms of getting you into treatment.
Now, you've talked a little bit about the process of finding a therapist, but for someone who's never gone to a therapist, it's very overwhelming on top of everything else that's going on. Mm-hmm. So are there any other suggestions you can give in terms of starting that process and how to know when you're in the right spot?
Sure, exactly. I talked about starting doing an interview process, but you really need to know what to expect. And some of the questions you should ask are, what is your success rate? Do people get better when they come to see you? What is your treatment approach? There are many different types of approaches. Some are more sort of cognitive therapy where they change the way you process information and think about things. Some people use behavior therapy where it's more about paying attention to changing behaviors. Ask about their hours and their fees. If you're working, you may need to go after work, and it's important to know if the therapist will treat you then. Ask them about their thoughts on medication, and do they use medication? Do they advocate medication in terms of antidepressants? Do they work well with other physicians? as a practicing therapist, I like to work closely with the neurologist who's treating the patient to talk about what they would recommend in terms of antidepressants. What other medications is the patient on at the time? This is very important to have a good working relationship with the treating physician. In terms of another suggestion of getting the most out of therapy, family members are often as affected by this disease as patients are. So involving the family if that's appropriate, and that's another question to ask the therapist. Do you work with family members? Trying to bring in real life experiences that you're going through, right then and there, so that you can work through those issues, in the therapy appointment. And lastly, I think you really need to be honest. Sometimes people want to come in and be good patients or good, and so they're not exactly forthright in what's really troubling them. What I feel is so valuable about the therapy experience is that it should be a place where a client can come and feel, there's no judgment. They can be themselves. They don't have to take care of me. A lot of times patients feel like they're taking care of and protecting other people in their lives, so they're never really able to reveal what's exactly going on or how much pain they may be in or how much they're struggling. That shouldn't be the case when you're in working with a therapist. You want to be able to let your guard down and have that be a safe, comfortable place where you can share your feelings. So.
Yeah, all great points, and I think the word safe really hit the mark, because that's what you want to feel like you can open up and share and not feel inhibited.
Right.
What else can patients do to best deal with depression?
Well, some of the things I've just been talking about are more externally focused, going to a therapist, talking to your doctor, perhaps taking antidepressants. But there are a lot of things that we can do just for ourselves, sort of internally, that can be helpful. One of the things I really ask clients to look at is forgiveness. I find when I begin talking to patients that there's a lot of blame, there's a lot of guilt towards themselves, for having the disease. I try to ask the clients, why do you think you got MS? And it's really interesting, the answers that come out. So, if you're sort of feeling angry at yourself, at God, at the doctors, at whoever, that anger oftentimes really doesn't serve much of a purpose in this case. And so to work at letting that go, forgiving whoever it is you're blaming, if you're feeling guilty, again, as I said at the beginning, understanding you didn't ask to get this disease, it's not your fault. So practicing forgiveness, practicing gratitude for the things that we do have and for the abilities that you have been able to maintain. Shifting that focus from what you don't have to what you do have and the things that are going right in your life, that right there can be an instant attitude change. They call it an attitude of gratitude, but it is true. It's hard to be feeling down when you're focusing on all the things that are going right. Talking to other people, friends, family members, not holding everything in. It doesn't have to be a therapist that you talk to these things about. But the important thing is that you stay connected to other people. You don't withdraw. You get involved in activities. That can be really hard to do when you're feeling depressed. You may not be motivated. A lot of us when we're depressed tend to kind of withdraw. But staying connected, getting outside of yourself, that's really helpful. Making time to exercise, making room in your life for the things you enjoy doing, like hobbies and people that you love. All of those things are things that we have control of and we can do for ourselves.
It seems that many of the changes that MS causes could really alter a person's sense of self. How do you deal with that?
Well, first of all, I just want to acknowledge that really is the case. Having a disease like MS, it can challenge our self-esteem on so many different levels. We go through many different changes. Our bodies change, so our feelings about our bodies may change. We all struggle with that, especially women. But when your body's not doing what you're asking it to do, or the shape of your body is changing because you can't exercise the way you used to, that's one issue. Again, I mentioned guilt, but the fact is MS often can cause people to have to either cut back on employment or stop working in a traditional job. So folks can get really wrapped up in the fact that they're not able to contribute financially. Perhaps as a mom, you're not able to go to the soccer games or participate in your children's lives at the level you would want to, so you experience a lot of guilt. these are all things that I think are, valid and that we need to be watching out for. If a client understands that they're at a high risk for these challenges, you can be on alert for it, and then it's time to get into that, let's take some action mode. What do we do? The one message I really try to get across to clients is that the beautiful thing about self-esteem is that we get to decide for ourselves how we view ourselves and how we value ourselves. It really isn't about all this external stuff, what we do. It's about who we are, and if we can believe that, we sort of project that to the rest of society and the people in our lives, they will take our lead. So if we're feeling good about ourselves, regardless of what it is we're actually physically doing, but in terms of who we actually are being, other people will pick up on that cue and they'll value us for the same reasons.
Many of the challenges to self-esteem seem to be related to the physical and emotional losses we experience. What should patients best do to cope with loss?
Well, I think with MS, it's unique in that we experience a number of losses because of this disease. Most diseases, you sort of get the disease and then you deal with the consequences. But with MS, especially if you have, let's say, relapsing remitting, you get a diagnosis, you deal with symptoms. They may sort of go into remission. We go through that one loss, we get a little better, but then we have another relapse. And this process continues. So there's a series of continuous losses. I tell people we kind of become experts in dealing with loss. But it's important, I think, to understand that these are losses. Every physical ability that we lose is another loss that needs to be grieved. And for many people, they associate loss with death, but loss is really any, loss, whether it's, we were talking earlier about moving, or a loss of a physical ability, a loss of a friend, a loss of a job. These are all very valid losses, and the key is we have to be able to recognize and acknowledge each loss that we have, and I think it's really helpful to have someone else actually bear witness to those losses and acknowledge as well that they're sorry that we're going through this. It doesn't help for others to sort of minimize these losses, and that happens a lot. I think people, they feel like they're making us feel better by saying, oh, that's not so bad, or oh, but you can still do this. But what we need to hear is, I am so sorry that you're going through this. I'm so sorry that you're not able to, still work a full-time job or drive or what have you. So getting that validation from someone else. But then it's time to move on. You grieve the loss, you get the acknowledgement, but then again, to shift our focus back to, okay, but what can I still do, and how can I still be productive? What do I still have to offer?
Earlier you mentioned anger being a common emotional reaction to MS. Is there any positive way to deal with anger?
There are positive ways to deal with it, and I think anger kind of gets a bad rap, especially again for women. We're sort of told, it's not ladylike to be angry and what have you. But anger is a very legitimate emotion in terms of dealing with something like MS. Many people feel extremely cheated. They feel cheated by what their bodies are doing. They feel betrayed. There are so many frustrations that we face, in addition to the everyday frustrations that, we all face. But when your body's not responding and your mind's not responding, of course you're going to get frustrated. Of course you're going to get angry. But the key here is, I think it's important to really focus in on what it is that you're angry at, rather than sort of walking around with just generally being angry at everybody and everything. If you can differentiate between what it is you're angry about and who it is you're angry at, that's helpful. It's, my husband often says to me, I'm really angry. I'm not angry at you, but I'm angry at the disease. And that's really helpful for me. And sometimes I will say the same thing. On the other hand, anger can be very appropriate and can actually be a helpful tool sometimes. I think every emotion that we have is given to us for a reason. So anger can often be sort of a self-protective tool. For instance, it may, encourage us or motivate us to get out of a dangerous situation, or to stick up for ourselves, if our questions aren't being answered or we aren't getting the treatment we feel we deserve. At that time, that anger can really serve a purpose and it can be helpful.
What roles do loneliness and isolation play in MS, and what are some solutions?
That's another really good question. In terms of loneliness, what happens with a disease like MS is that oftentimes patients end up feeling very misunderstood. There's a variety of reasons for this, very good reasons. Number one, I think, is the invisibility of the disease. For instance, if you look at me, hopefully I'll look like a relatively healthy person, but there could be many different things going on with me, things like vertigo, bowel and bladder issues, vision problems, fatigue, cognitive issues. These are all invisible. And so I could be sitting across the table from a very good girlfriend dealing with all of these things, but she would never suspect it. So there's this feeling kind of being misunderstood or not really fully known. So in that respect, we can feel kind of lonely and isolated. The other thing that happens, I mentioned this earlier, is we may try to sort of protect other people that we care about in our lives from really knowing how difficult things are for us. So in a way, we think we're protecting them, but again, it puts them at a distance so that they're not really, getting it. They don't really understand what we're going through. And so more and more people begin to feel like no one really knows me, no one really understands how difficult and hard this is, although we are playing a role in that. The other thing that I think happens is that sometimes people don't really want to understand, because if they do acknowledge how difficult it is, maybe they have to change their behaviors or make accommodations. My husband would love to feel like I can still do everything and cook and clean and work and what have you, because then he doesn't have to pitch in and help. So it's up to me to really kind of let him know when I'm having a bad day or when I need the extra help. Another thing that happens, and this is, really a hard thing to kind of avoid, but if you're having physical difficulties, if you need to use a wheelchair or you're no longer able to drive, you can end up spending more and more time at home and becoming physically isolated. It just becomes too hard to kind of, get out of the house. There are other things such as bowel and bladder issues that can make people feel sort of embarrassed to be around others. I've talked to a lot of clients who have cognitive issues, and what happens there is when they get in a crowd or a social situation, it's harder for them to think clearly, to process information. They may feel forgetful, and that becomes embarrassing. So rather than go out and be social, they just sort of play it safe and stay at home.
So those are some of the challenges. Now, what about solutions?
Well, that's what I like to talk about the most, are the solutions. And I think one of the healthiest and really best coping skills for any of the issues that we're talking about is staying connected with other people and making sure that you maintain your relationships and also develop other relationships. That would include getting involved in support groups, talking to other people who have MS. These things are really helpful, and there's so many ways to do that now. If going to a group isn't your thing, the internet offers so much in terms of chat rooms, blogging. MSAA has several programs that you can take a look at. The National MS Society has several groups. There's MS World, there's Health Talk. So there are so many ways to kind of reach out and stay connected and learn more and be proactive. It's wonderful. I think also working with others and understanding that you have to take the responsibility for letting others know what's going on with you. You're really not helping anyone by holding it in, by protecting other people. Being real, telling them what's going on, you're going to be a lot more likely to stay connected and to be lifted up by other people and supported.
Yeah, because the people in your support system can't read your mind, so you have to help them out a little bit.
Exactly.
Well, finally, you mentioned that in addition to our physical and emotional health, that we should also nurture our spiritual lives. Can you talk a little bit more about that?
Sure, and you don't hear much about that when it comes to healing. You hear a lot about the physical, and sometimes you hear about the emotional, but the spiritual piece is really key. And I want to emphasize here that when I mention spirituality, that's a very individual, personal belief system, and I'm not advocating that it be any one thing. But spirituality is a huge piece of healing. It can be, typical religion or what have you, but it can also just be spending time in nature, in song, giving to others. It doesn't matter what it is. It just matters that you really, recognize what has meaning for you and that you try to do some type of spiritual practice on a regular basis. What I find in working with my clients, the people who have a strong spiritual base, they are the ones that really, no matter what else is going on, out here, things that they don't have control over, they have this really wonderful place to always come back to. It keeps them grounded, it keeps them centered, and it keeps them calm. And so having that as a tool, if you will, it really can help in terms of healing. The second part of that is what I call finding your bliss. And I'm surprised that people don't talk more about this, because the question I want people to answer is, what are you staying well for? What are you fighting to keep your health for? What makes you want to get up every day and keep, fighting the good fight? This is a really critical question to answer for yourself. And it can be anything, just like spirituality. It can be a grandchild. It can be a relationship. It can be, a creative act like painting or gardening. It doesn't matter what it is. But again, writing it down, maybe even having a picture of whatever it is, and put that on the refrigerator. So those days when, you really don't want to get up and do it all over again, you can look at that picture and say, okay, this is what I'm doing it for. For me, right now, we were talking earlier, my bliss is my Bernese Mountain Dog, Ellie, and of course my husband, Sven. Sven gets very upset when I don't throw him into the bliss package, but, I can't even talk about her without smiling and feeling good. And so what I want you to do is really kind of identify for yourself what makes you smile, and then make sure that you make space and room for that in your life.
That's just great advice for life, and especially for someone living with MS. Valuable insight for everyone. Thank you so much for being with us.
Thank you.
This concludes our program, A Closer Look at the Emotional Impact of MS. On behalf of MSAA, I want to thank Allison Shaddy for providing us with a better understanding of this important topic, and EMD Serono and Pfizer for their support of this program.